Hi, this is Dr. Kirti Shri. Hope all are doing well. So, I have joined MD Geriatric Medicine at MMC, located at National Center of Aging, Guindy. This video is mainly about the orientation of geriatric medicine. I think most of you might be unaware or maybe newly heard the term geriatrics, including myself. எனக்கே வந்து இந்த கவுன்சிலிங் ப்ராசஸ் அப்போ ஓகே ஜீரியாட்ரிக் மெடிசன் இஸ் அ பிரான்ச் ஆஃப் மெடிசன் எனக்கு தெரிய வந்துச்சு. லைக் பீடியாட்ரிக்ஸ் வந்து சில்ட்ரன் பிலோ 12 years இருக்கிற மாதிரி ஜீரியாட்ரிக்ஸ் வந்து ஃபார் எல்டர்லி பீப்புள் more than 60 years in developing countries and more than 65 years for developed countries வந்து ஃபங்க்ஷன் ஆகிக்கிட்டு இருக்கு. The term geriatrics was proposed by Dr. Nasher, New York physician, in the first decade of 20th century. He noticed the vulnerability of older population, especially loss of adaptability, that is called frailty, and recognized the importance of environmental and social factors. Mother of modern geriatrics under Dr. Marjorie Warren, she co-founded the Medical Society of Care for Elderly in 1947. She promoted the importance of multidisciplinary team approach and early mobilization for elderly and encouraging them to do active involvement in their daily activities. So I can proudly say that in India, Madras Medical College was the first college to launch a separate geriatric medicine ward in 1978, followed by AIMS New Delhi 2012. Under National Program of Healthcare of Elderly வந்து separate regional centers for geriatrics elderly population வந்து AIMS New Delhi build பண்ணியிருக்காங்க and Madras Medical College followed by வாரணாசியில் propose பண்ணியிருக்காங்க. So why do we need geriatricians? இதுக்கு தான் physician இருக்காங்களே ட்ரீட் பண்ணுறதுக்கு. Why geriatrician? அந்த கேள்விக்கு ஆன்சர் வந்து a simple logic. Maybe geriatricians are here to recheck the patient or prevent harmful side effects of the polypharmacy or the extra drugs which they're taking. Not only the drugs but also the treatment or maybe the help with the consequences of mistakes or maybe recheck the patient's treatment and drug protocols. So for example, when if prolonged bed stay or bedridden patients வந்து bed sores வரலாம், pressure sores வரலாம். ஸோ அதுக்கு வந்து ஃப்ரீக்வெண்ட்டாக அவங்க வந்து பாஸ்டரை சேஞ்ச் பண்ணிக்கிட்டே இருக்கணும். Another example is the polypharmacy, that is the elderly population வந்து they're more vulnerable and they have low metabolism, so they are more encounters of the adverse side effects. So அதனால we should recognize the hazards of polypharmacy. This geriatrics all revolves around the term aging. What is aging? Aging is not a disease. It is a process where the young adults grow to older human beings. It is a multi-dimensional process where it involves your physical health, mental health, psychological health, and social well-being. My 1 week experience as a geriatrician வந்து they don't present as a textbook findings and they are not very easy to diagnose also. They have a very atypical presentation and in most of the cases their chief complaints may not correlate with the diseases or syndromes they might have. I am a geriatrician where the I involves mainly their instability, immobility which may cause falls, and they have sleeping troubles, insomnia இருக்கலாம், இல்லை urinary incontinence, impairment of vision, hearing, impaction of stools, constipation, isolation which can also lead to depression in elderly, intellectual impairment affecting their cognition, memory, and finally iatrogenic or unnecessary drugs or unnecessary treatment which is not required. Backbone of geriatrics are the 5 M's, which is mind, mentation, mobility, multi-complexity, and what matters most. What matters most is the priority of the patient. What does he need? So எப்போமே symptomatica first approach பண்ணிட்டு then we have to go back to the underlying main issue what the patient has. Geriatrics also have geriatric syndromes. அதில் வந்து you have delirium, disability, falls, urinary incontinence and pressure sores. So முன்னாடியே சொன்ன மாதிரி elderly population, they are also like extreme group of people where they are more exposed to certain conditions. So இதை வந்து நம்ம syndromes இங்கே பிரிச்சிருக்கோம். This National Center of Aging comes under the National Program of Healthcare of Elderly. It promotes the healthcare, preventive treatment and rehabilitative facilities for the elderly population. Its main objective is the easy affordability, accessibility, preventive rehabilitative facility in the community-based primary healthcare. National Program of Healthcare of Elderly was launched in 2010 and 2012 வந்து AIMS New Delhi வந்து a new department was launched, and in 2024 in February தான் the separate institute வந்து இங்க கிண்டியில் வந்து launch ஆயிருக்கு with 200 bedded inpatient facilities. What are the scope of geriatrician? அப்படின்னு நம்ம கேட்டோம்னா, the growing population is going towards the geriatric, so obviously it is an emerging and new branch where we can excel in treating the patients. They have a unique healthcare specifications as I discussed. This geriatric medicine and geriatricians, they help to ensure a healthy and dignified healthcare for our seniors. So thank you so much for watching this video and getting oriented with me. So please continue watching this video and subscribe to this channel to get to know more interesting case studies in geriatric population. Bye. பட் அப்படியே உங்களை நான் சும்மா விட மாட்டேன். ஸோ ஹியர்ஸ் இன்ட்ரெஸ்டிங் ரிடில் வந்து ஒரு சூஸ் த கரெக்ட் ஆன்சர் மாதிரி கேட்க போகிறேன். சின்ஸ் ஐ எம் அ ஜீரியாட்ரிஷியன் வில் பி கோயிங் மோர் டுவர்ட்ஸ் திஸ் மெடிசின், மோர் டுவர்ட்ஸ் திஸ் பிரான்ச். ஸோ ஃபார் பிகினர்ஸ் வந்து ஃபார் ஸ்டார்டிங் ஸ்டேஜில் வந்து வாட் இஸ் த பிக்கெஸ்ட் மித் யூ ஹவ் ஹர்ட் அபவுட் ஓல்ட் ஏஜ்? எவ்ரிதிங் ஃபால்ஸ் டவுன் ஹில் ஆஃப்டர் 60 இயர்ஸா, இல்லை யோர் மெமரி கோஸ் டவுன் as you grow old, or you can't grow new skills? idla yedhu truth yedhu myth therinja please drop it in comments. Keep watching this channel for more interesting case studies on geriatric population. Bye.